Today, I'm joined by Julie Dalsgaard, CEO of Lifeline Robotics, a Danish MedTech startup born during the height of the COVID-19 pandemic. In this episode, we talk about what it's like to build a MedTech company in the middle of a global crisis, the unexpected twists of becoming a pandemic startup, and the transition from emergency use to everyday clinical relevance. Julie shares what it's like to lead a startup through the long, winding valley of death, and how Lifeline Robotics pivoted towards general practice care. Also, what happens when you're stuck between the two definitions of robotics company and medical device firm. Finally, she gives powerful advice to first-time founders. Don't go it alone, find mentors, lean into guidance, and take things one step at a time. Welcome, Julie. Thanks very much for making time for me today. Would you like to talk a little bit about yourself and your role and your company and just kind of do a light introduction?
Sure. Yeah, first of all, thank you for having me on. It's always nice to share these quite incredible journeys that most of us are on. My name is Julie Dalsgaard, and I'm the CEO of Lifeline Robotics. So we're a MedTech company founded in the middle of the pandemic, basically in April 2020. We're based in Denmark, so it was during the first close down we had here. The company actually started as an idea, both from some professors at the local university, but at the same time, it came to mind at people with a robotics and automation background. And all of these people could see that we suddenly had this intense testing need in Denmark and in the world, where everybody showed up to these testing tents or locations, depending on where it was. And people had these manual samples taken initially from nurses and healthcare personnel, and then later on, as the need grew, a lot of different people were hired into this process. So these minds of automation and research and innovation very quickly gathered some funds back then and developed a very early prototype that were able to swap to show that it was actually possible to automate it. I myself was actually studying at that time doing my master thesis in a completely different subject. I was one of those that graduated online due to the pandemic and then stood there thinking, wow, what kind of job market meets me now that I'm finished and everything, is away from normal circumstances. A lot of companies were totally flipped over. But I stood there and had an option of continuing with research-based tasks at the university where my supervisor wanted to hire me in, or I was offered this job at a new startup working on a problem related to the pandemic that everyone could feel close to heart for most. And, freshly graduated, didn't have anything that really committed me. So I took the chance back then to jump into this startup life. My background is actually in engineering, one of those soft engineering degrees. It's called product development and innovation. So not a robotics engineer at all.
I had a question. You mentioned that the company kind of springs from academia, and you're clearly coming fresh into this from academia. How does that influence the product or its pathway and its potential success avenues? Would you say?
I must highlight that we're a very odd case, I would say. It's true that we're not, I wouldn't say we're a spin-out from academia, because the way this worked was that all of the researchers at the local university, it was shut down there as well, like in many other companies. They couldn't continue with classes and all this stuff they normally did on everyday basis. So there was suddenly a research group within robotics that had free time, and then we could hire them in or do a collaboration with the university to try and make this project viable or feasible, at least from a technical point of view. So it's not a classical academia sprouted project, but sort of a very quick public-private partnership that was created very early on in the process. It, of course, gave the project some branding value very early on. We were featured in many different news articles, stories, both nationally and internationally. It gave some solid grounds and trustworthiness, I would say, to the project as compared to what I can imagine it would have been if it was just me, for example, founding the company and then doing something on my own. Because we had some big names and some big institutions on from day zero. So in the early days of the project, maybe the first year or two, we actually had quite a lot of benefits from the way of starting this company.
When we started this call, we mentioned the valley and death, and this kind of stage of advanced product development and clinical validation. And I think that you as a company are kind of just on the cusp of kind of commercialization and CE marks and these kind of things. Like, could you describe what it feels like to be in that space and your perspective on how to get out of it?
Yeah. Oh, it's a long process, right? I think the valley of death is something all startups look into at some point. But I think for medical device, MedTech startups, it's a much longer process than for many other industries. Even though we're, a bit odd case that started in a different way, we had many different focuses along the way because we did start in the middle of a crisis and we had to pivot a lot along the way. We're still pivoting a bit, but being in this sort of valley for almost 5 years now, I would say, for us, with a bit up and downs along the way, but still below ground. It definitely it takes a toll on everyone in the company. I think the way we handled it is trying not to, I would say, look completely out of the valley, not trying to imagine 5 or 10 years out in the future, because that's simply too far away. There's so much work to be done to be fully on the other side. So if we have that idea of that we must be able to look into the future for so many years, it just becomes overwhelming for a lot of people on an everyday basis. So we really try to break it down to attainable goals over time, maybe 6 months or a year, break the process down to something that everyone can handle and manage and understand, and then just take one step at a time throughout this sometimes really long valley, right? Probably right at almost nearing the bottom, right? Because we have funding from very early on, again from day zero, and the definition of the valley is that when you get your funding until you have like commercial traction and a more financial stable bottom to stand on, and we're not there yet because we are not commercial yet. But it's been a long process for us trying to get through.
It's interesting. I think there were many very, need-driven incentives inside of the pandemic, and yours being one where clear identified problems and really good, fast-thinking problem solving. So creating lots of these kind of pandemic babies, as we might call them. Everybody's kind of graduating from that intense period of creativity and possibility into how does that, being a pandemic baby as a company, how do you go from that into, I don't want to call it normality, we're not in normality, but into some stage of normality?
Yeah, I'd say first of all, I wouldn't recommend it to anyone. I'm sort of educated in innovation and how to develop new things in the world, and starting in the middle of a pandemic is not a textbook way of doing it at all. A pandemic and a crisis it's not a stable condition at all. There is a need in the moment, but that need shifted quite quickly. And we experienced that as a company very hard, actually, and very early on in our history as well. So as I said, we were founded in April 2020, and already, even though we were really, really quick to develop something, then it hit that, this is a medical device, because the focus has just been so much on the technical aspects of it that the focus hadn't been around the regulatory parts of it. We knew that there were something about emergency approvals, but resources are finite, so the focus was on the technical parts. So very suddenly we was almost met with a demand from the entire world and so many different industries that wanted to buy a robot that we were not allowed to sell, because it wasn't, first of all, it wasn't good enough to sell, I would say, but we weren't allowed to. It was not legal for us to sell it anyway. And then we sort of hit in autumn 2020, so we're down to like a 6-month period here. And then the word vaccine suddenly became very normal for everyone to hear, because the funding in the vaccine programs had risen exponentially as well. So they have very quickly developed solutions as well. So suddenly the interest for our product not diminished, but it changed quite quickly. And then everyone also thought, oh, the pandemic is over. Now the vaccines will come and everyone will be good and everything will go back to normal. And then it shifted up and down for, I would say, almost 3 years, where in the summer period, we were not interested at all. And then during winter, when people could see these spikes of COVID and new variations, new mutations coming every winter, we were suddenly an interesting company again. But it was a lot of times where, we sort of had this kill your darlings kind of approach, where could we even see a way out of this? And at one point, we sort of had to make the strategic decision that we can continue to build a company on a pandemic or on the grounds of a pandemic, because it's just too unstable for us to be in, both from a business perspective, but also just on day-to-day working life, where you don't really know what you're working for or towards, because the demand and the interest just changed so quickly. So we looked at what can we do instead. We continued to hold on to the core technology, because a lot of funding had been put into that, a lot of hours, a lot of resources to develop what we have today. So the founders of the company and the investors weren't really quite ready to let go of it. And the team here, me and the core team, could still see some opportunities outside of the pandemic outlook. So we actually sort of went back to the way to probably have started, the way normal medical devices and medtech innovation start. That's in a clinical need, right? You look at where could we optimize or improve on a process that exists under normal circumstances.
That is the nature of the startups in that respect. Even though you were born in the pandemic, the nature is that to survive the valley of death, you must pivot at some point, right? There has to be every single company, and it's the lack of pivot that can leave you stuck in there for indefinite periods of time. So I guess what you're doing is very natural, even though your company was born into very unusual circumstances.
Definitely, yeah. Or, if the pandemic had continued in the way it did for the first few years, we would be a very successful company today. I would think a lot of people have told us, wow, if this product was actually ready when the pandemic hit, it would have been a completely different story. But we did this pivot to maintain the technology and to maintain the advancements we have made. And we pivoted over to, where do we normally take throat swabs, which is what we do. We have automated the throat swab process from being manual to automated. And you do that at your general practitioner, your family doctor. You go there when you have a sore throat, you're coughing, something's going on, and they test you for different kind of bacteria to see whether you should be treated or not. So that's sort of the market we have shifted over to, instead of relying on this intense demand that could be in winter periods, or, relying on that, okay, another pandemic will probably come, but we don't know when, and you can't build a business on that. And so we had to find that stable case, and that's what we pivoted over to strategically, and that's the focus we have maintained, even though we still see a lot of movements happening in the pandemic space. And it's still very interesting, because we really do believe that we could add some value to all of this pandemic preparedness that the world is focusing and should focus more on, to avoid a new COVID or similar in the future.
What's your I'd say there's a lot of criticism about the medical device regulations and the time it takes to get approvals and, waiting for notified bodies and all of this kind of logjam. What's your experience of this going into it for the first time and as a young company?
Yeah, wow, it's been a process and an intense learning curve. So yeah, we have a bit of an odd product again as well, right? Because we're adding the robotics element to a medical device. And in many people's eyes, we're a robotic company and not a medical device company. In other people's eyes, we're a medical device company and not a robotic company, but we're sort of in between. So we have a lot of times sort of fallen between two chairs. And that quickly showed itself in the regulatory process because it was really difficult for us to even classify our product. Are we class 1, 2, and 3? And the different advisors we had from different companies also had trouble with it. Because we were, developing something so new and in a context that hadn't really been seen. So we spent, I would say, almost 2 years from the very beginning to the point where we were actually sure that we are class 1 device. And then we had to build the entire regulatory aspects in the company. So we started to hire one in. So we had one internal resource that could put his entire focus on this. He's done a great job during the past 3 years, and now we know everything that needs to be known. But it's definitely one of the barriers for many people coming into the industry, and it's a shame that it's not easier to get an understanding of it or to get some supervision, at least in the EU. I often think about all the innovations and improvements that might fall to ground because someone is just met by that regulatory wall and gives up. But it's a process. It definitely is. We have an automated product, a fully automated product that should work with the user. A lot of medical devices is developed to a doctor or a nurse or a hospital ward or where it's educated healthcare personnel that will use the product. We are developing a product that the ordinary person just coming in from the streets should be able to use. So it's a very different narrative, and we must have an incredible amount of focus on usability because there could come an 85-year-old man that has never in his life seen a robot before. How should he interact with our product? There might also come a young person, studying robotics engineer at the local university, and he knows everything. He might even know more about robotics than I do, but we have to cover really wide in our user spectrum and be able to make sure that our product is so useful and so intuitive that everyone is able to use it autonomously.
Final question. What's the kind of your big takeaway, your big one piece of advice that you would give to a founder coming in a similar pathway to you, like yourself, a few years ago, becoming a CEO and joining a startup, and what would your strongest advice be?
Oh, yeah, that's a really good question. I would say that one of the most important things is to find guidance somewhere. Find someone that knows more about this space than you do. Because the chance of, especially like me, I came in with zero experience and zero knowledge of this field. And if I have had someone close to me that I could have talked with, given me some quick introductions to all of these elements, we might have been able to save some time here and there, but it would at least have given me some calm. It would calm my soul that I had known more about what we were doing and what the direction were and where we're on the right track and what were the up and downs of this. And who that person should be is always really difficult. But there is very likely someone with more experience, companies that have gone through the valley of death, is on the other side. They can suddenly see the traction that the startups are dreaming of, because that's often where you are. Like our main goal right now is to see our product out in real life, outside of the workshop, right? That's milestone 1, seeing it in use. Someone who has achieved that can tell you a lot about their learnings on this path and during this valley. So that's definitely something I would recommend anyone approaching this.
Super good advice. Julie, thanks so much for making time and talking to us today. I think you've got some really valuable, interesting insights here. That's a wrap for this episode of Walk the Valley. Hearing from Julie offered us a raw and real perspective on what it takes to build a medtech company in extraordinary times. Her story reminds us of how grit, adaptability, and humility are essential in the valley of death. Some key takeaways: pivoting isn't a weakness, it's a survival strategy. Second, when innovation meets regulation, clarity and mentorship become your best allies. And finally, no matter how intense the journey feels, breaking it into manageable steps is what keeps you and your team moving forward. If this episode resonates with you, we'd love for you to subscribe and leave a review. It helps us share more unfiltered insights from the people building the future of healthcare. And remember, you can now listen to Walk the Valley on Apple Podcasts and Spotify. Thanks for tuning in, and until next time, keep walking the valley.